Begin with this breaking news from the U.S. health officials. The CDC and FDA are recommending a pause in the Johnson & Johnson COVID-19 vaccine. Here's why. 6 people in the U.S. who received the single-dose vaccine developed a rare disorder involving blood clots. All were women between the ages of 18 and 48, and one of the women died. Let's put this in context, though. As of April 12th, more than 6.8 million doses of the J&J vaccine have been administered. That's according to the agencies. Representatives from J&J didn't immediately respond to a request for comment. The recommended pause may further complicate efforts to vaccinate the world just weeks after a vaccine relying on a similar approach developed by AstraZeneca and the University of Oxford raised similar concerns in Europe. White House economic advisor Jared Bernstein had this to say this morning when pushed on the news from Bloomberg TV.
I think before we can make the kinds of timing determinations that you're asking about, we have to understand how disruptive this is, and we just don't know yet.
Well, joining me now on the phone is Bloomberg Intelligence pharmaceuticals analyst and opinion contributor, Sam Fazeli. Hey, Sam, great to have you on the show. Look, as someone who knows the science and the field, how concerned should people be off this news?
Yeah, that's a very difficult one to answer because at the end of the day, it depends where you are. And I would say that if you are based in the United States, which looking at the number of doses of mRNA vaccines that it has potentially coming by the end of July, you don't need the J&J vaccine to get up to about 300 million people vaccinated. And that's really pretty much more than the adult population of the U.S. So for the U.S., I'm not worried. What I'm worried about is the rest of the world, and that is a problem, especially if you think that between J&J and AstraZeneca, I think well over 3 billion doses were supposed to be delivered.
Yeah, well, okay, so let's put this into context, like I did with the 6 cases of this occurring in a sample of nearly 7 million shots administered here in the U.S. The chances of this happening are really small, and aren't there other drugs and treatments out there with side effect profiles with greater numbers and greater side effects?
Sure there are, but I'm pretty sure that if you had an option of taking this vaccine or another vaccine that you knew did not have the same side effect, you would make the decision to take the other vaccine. That is, we can't, whatever the case, the rate of side effect is. The issue also is that let's not forget that this 6 cases out of 6.8 million doses, it takes 4 to 10 days for these events to occur. Not all of those 6.8 million doses were given 10 days ago, right? So people have been continuing to get doses, and I think you said that, I can't remember what the cutoff date you gave was. Was it as of 2 days ago?
Well,
there was 6.8 million doses?
Yeah.
12, right? So
Go ahead.
You have to wait till the 22nd to get a better feel.
And Sam, here in New York, we're just learning that the state will pause all J&J vaccine statewide. The state of New York saying that all appointments for J&J vaccines will get Pfizer as a result of this news coming from the federal government. What do you make of that change?
Yeah, that's the right thing to do. Why expose people to this, even if it's 1 in a million risk, if you have other vaccines that don't have the risk? It's a very simple equation. You come over to the UK, you come over to the European Union, today you don't have any other vaccines to offer people, then you have to start making the kind of decisions that people have made in Europe at certain ages. And then, of course, the rest of the world is even more complicated than that.
Sam, help us draw a distinction between the J&J vaccine and what we know about the blood clots and the issues with AstraZeneca's jab.
Yeah, but from what I understand, and a lot will become clearer tomorrow at the CDC meeting, is that this is the same kind of a clotting event. This is not a random type of clotting event that people keep talking about when they talk about the contraceptive pill. This is not the kind of clotting event that you get by getting on an airplane. We understand all those. This is one where you get the clotting, and at the same time, you get a significant drop in your platelets called thrombocytopenia. It's the combination of the two that makes this such a difficult beast and rare beast. So that's the problem. And it appears to me, from what I've read so far, so lots of caveats there, that it's the same kind of issues that AstraZeneca has been seeing.
I want to pull up a tweet that caught my attention this morning after this news broke. This one's from Nate Silver, known of 538, the polling expert here in the U.S. He wrote, quote, 6 cases out of 7 million people. What a disaster. This is going to get people killed, and it's going to create more vaccine hesitancy. These people don't understand cost-benefit analysis. They keep making mistakes by orders of magnitude. What do you think of Silver's comments there? Cost-benefit analysis.
That seems a bit harsh. Any side effect with vaccine will drive people to worry about it. I am due my second AstraZeneca vaccine dose in June. I am worried about it, even though I'm not in the age group that supposedly has the highest risks. But at the end of the day, I have to make a choice based in Europe as to what I want from my society. Do I want lockdowns and difficulties right the way through to the end of the year, or am I accepting the risk, that small risk that there is? So we are not killing people. The Pfizer-BioNTech vaccine, the mRNA vaccines, have not got this very rare side effect. And if tomorrow the CDC says, actually, we've given it to 3 million people, or in the European Union, they've given it to 3 million people above the age of 60, nobody's had an event, there you have a solution.
Is this the end of the J&J vaccine, Sam?
I think it's too soon to say that, absolutely too soon to say that. We have to wait and see. And again, it all comes down to if you live in a country which has got tens of thousands of cases a day with massive hospitalizations and deaths and no other choice but the J&J vaccine, that equation is a very different one to one that needs to be solved over in the United States.
So does that mean that the J&J vaccine goes from being a vaccine that's administered in areas of the world that have access to mRNA vaccines to going to areas of the world exclusively that don't have access to those?
But that again comes down to the rate of cases that you have. If you go to a New Zealand, which hardly has any cases, they have the luxury of waiting for more mRNA vaccines. If you go to Australia, which has very few cases, but even there they've decided not to run with with at least the AstraZeneca vaccine. It depends entirely on how things are evolving within your nation. And yes, unfortunately, we'll come down to that.
Bloomberg Intelligence Senior Pharmaceuticals Analyst Sam Fazeli. Sam, thanks so much for taking the time joining us on this breaking news. Really appreciate it.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.